Hospital in Kranskop in the KwaZulu-Natal midlands, calling for the removal of COVID-19 patients from the facility. Police say the protest started last night and resumed this morning. Protesters blockaded entrance to the hospital, demanding that the affected patients be moved. The Ntunjambili Hospital was identified as a quarantine facility for COVID-19 patients. Let's get more on the story across to our reporter Ayanda Mhlongo in Kranskop. Very good afternoon to Ayanda. 759 COVID cases in KwaZulu-Natal, and it seems there's anger about where people are being treated. Tell us more.
Yeah, very good morning to you. Good morning to our viewers at home. Certainly, we are met by very, very angry residents here in the area of Ntunjambili outside Kranskop, where community members have shut down the entrances, as you said, to this hospital, saying that they want the patient who they are saying there's about 10 patients inside who have tested positive for COVID-19, and they believe that these patients have been brought in from other areas. They're saying that they've not been consulted as a community. Both the staff who work at the hospital, who are also members of this community, are fearful that there could be some sort of contamination. A spread of the virus from issues relating to the PPEs. They're saying that these are their sisters, these are their brothers and mothers who are working inside the hospital, and they know that this hospital is not adequately, does not have the resources to be able to take in these patients. As it is, it's a hospital that has been struggling to service this community, and it services quite a big area from KwaMaphumulo all the way to Nkandla, which is quite a vast area. So hundreds of people are expected to be serviced at this hospital. And I just moved out of Shati and Zinga so you can see the community members that have gathered there. Of course, these type of gatherings, are more than 50 people who have gathered here, is illegal. There is a heavy police deployment in the area as well. These community members are saying that they want the health officials to come through and speak to them. They're saying there has not been any awareness campaigns in the area. They would have preferred had there been some sort of awareness campaign going house to house, even if it was issuing pamphlets and the sanitizers to the community, so that to allay the community fears. But let me just quickly bring in a community member very quickly, just to get from their side exactly what are their concerns. But blessing shangasmonga khulu nje isikhathi sakho mhlawumbe futhi njengoba umphakathi uhlangene siyazi ukuthi manje usuphula imithetho le lockdown, kodwa nithi umphakathi uthi uyasaba njengoba sekhona iziguli enithi zinalo leli gciwane esezikulesibhedlela.
Yes, khona sinakho kusaba ngoba kwathina siyibona singaphephile, but ngesimo sokuthi siyabona ukuthi isimo sikanje sibonile asiphume silwele umphakathi wethu ukuthi ungaze usafarishe, ngoba siyabona impela ukulethwa kwalabantu besuka eindaweni ese-identifyiwe njengeindawo ezine corona, ezine COVID-19. So belethwa endaweni ebi-identifyiwe njengendawo engenayo not a single one person onayo. But we don't understand ukuthi bafike kanjani kuleso sinqumo ekutheni bezofaka abantu abane corona le ekule ndawo enabantu abangenayo.
Kafushane nje ubusitela ukuthi ngeke nazama ukuxhumana neziphathimandla zesibhedlela ukuthi beze nomnyango wezempilo ukuthi beze bezoxoxisana nawo umphakathi bezama ukuthi bawuqwashise ngaso lesifo.
Yes, izolo ngicabanga ukuthi ngabo 7 sihlanganile soumphakathi sanikela khona esibhedlela. Ikhona imanagement yesibhedlela efikile ukuthi kukhulunywe kuboniswane, so safika la sivumelana khona ukuthi asihlangane kusasa ngoba since ade kusebusuku izolo ngo11 bekwazi ukufika kuthini. Sa decide ekutheni ongenani ngo9 kuzobe khona MEC ozobe addressa le issue, then bese sibone sifika kanjani kwi decision.
Okay. All right, Sabonga Khulu. All right, that was just one of the community members here just speaking to us about their concerns, basically telling us that what they wanted as a community was for the health department or the provincial government here in KwaZulu-Natal to come to the community and to explain to them and to allay some of the fears that residents in this area have. A lot of people seemingly do not understand much in terms of the virus, but they're also saying that beyond that, and saying they've also got other concerns of service service delivery, that there are water shortages in this area. There's serious transport issues. And so these all coupled together, the community is saying that they're going to continue to protest until the health officials or the provincial government comes to address them.
But Ayanda, where are the police and where are the officials to address those concerns and to make sure that lockdown regulations are being followed?
Since arriving here this morning, there has been a heavy police presence. It's quite a big area where we are. There are two entrances to this hospital. In fact, we're in between the two entrances. And so we've been seeing the police moving around across the area as the community have been moving in groups. And so we've also seen quite a heavy police presence. We understand that there's a number of people also that have been arrested. We've been in communication with the health department and still we are waiting for their responses in terms of what is happening at the hospital currently. There were some patients that we saw when we arrived this morning that were leaving the hospital. In fact, it's quite a difficult situation because it's quite a distance that these patients were now having to leave the hospital and walk with all their luggage. Some had children because there is no transport in the area, and they're very upset, saying that they've been told to leave the hospital. So it seems that there is indeed quite a number of issues that are here, which is possibly one of the reasons that have led to this community coming out and protest. We haven't yet heard from the Department of Health whether or not they will be sending a delegation or people to come and speak to the community or the provincial government, which the community has said until they come and address them and allay the community fears, they are going to continue to blockade the entry into the hospital.
Sure, Ayanda Mhlongo giving us an update from KwaZulu-Natal there. Stay safe and keep us informed about what happens next.